So you just lost your tooth or are about to lose your tooth, and you're trying to figure out what to do. Well, you have a few options. First is, you could do nothing at all. The issue with doing nothing is over time, you'll start to lose bone in the area where the tooth used to be. Additionally, it can provide a cosmetic limitation, and also, naturally, you will begin to shift your food and your bite to the side that has more teeth. The problem with that is over time, those teeth will get overused and you will see a faster breakdown of those teeth. So what are your options? First is, you can have a dental implant. A dental implant is your best solution because it's a single tooth solution for a single tooth problem. It does not involve the damage to adjacent teeth and restores the normal function of your bite. Another option is a 3-tooth bridge. Also a good solution, which has been the primary solution prior to dental implants. A 3-tooth bridge involves the adjustment of adjacent teeth. If you've ever had a crown before, it's essentially like doing a crown on either side of the missing space and then connecting 3 teeth together with an artificial tooth in the middle. A good solution, and sometimes a better solution, over a dental implant based on certain clinical parameters. The final solution could be a removable appliance or something that comes in and out. This is usually the most foreign and has the biggest adjustment process, especially for people who are not used to wearing one. I hope this helps. Thanks so much.